What are H. pylori testing methods for ulcers? Imagine discovering the hidden cause of your stomach discomfort could be easier than you think. When it comes to ulcers caused by Helicobacter pylori, or H. pylori, doctors have several reliable ways to find out if this bacteria is involved. Understanding these methods can help you know what to expect if your doctor suspects an infection. The first line of testing is often the urea breath test. In this test, you drink a special liquid containing urea labeled with a harmless form of carbon. If H. pylori bacteria are present in your stomach, they produce an enzyme called urease that breaks down the urea, releasing carbon dioxide with the label. This carbon dioxide is then measured in your breath. The urea breath test is very accurate, with nearly perfect sensitivity and specificity, making it a favorite for diagnosis and checking if treatment worked. However, you need to stop taking certain medications like proton pump inhibitors at least 2 weeks before the test because they can interfere with results. The test is quick and non-invasive, but it can be a bit costly and requires you to breathe into a collection device. Another common non-invasive method is the stool antigen test. This test looks for pieces of H. pylori bacteria in your stool using special antibodies. It is just as accurate as the breath test when done properly and is often less expensive and easier to perform. Like the breath test, you should avoid proton pump inhibitors for 2 weeks before testing to improve accuracy. This test is useful not only for initial diagnosis but also for confirming if the bacteria has been successfully eradicated after treatment. Blood tests are also available, which detect antibodies against H. pylori in your blood. While they can tell if you've been exposed to the bacteria at some point, they cannot distinguish between an active infection and a past one. Therefore, blood tests are less helpful for confirming whether the bacteria are currently causing problems or for checking if treatment has been successful. For more invasive options, doctors may perform an upper gastrointestinal endoscopy. During this procedure, a thin tube with a camera is inserted into your stomach, allowing the doctor to see the lining directly. They can take small tissue samples, called biopsies. These samples can be examined under a microscope to spot H. pylori or tested with a rapid urease test, which detects the bacteria's urease enzyme by observing a color change in a special medium. Culturing the bacteria from the biopsy is also possible and can help determine which antibiotics might work best, but this is more complex and costly. In general, non-invasive tests like the urea breath test and stool antigen test are preferred for initial diagnosis because they are safe, accurate, and convenient. Invasive tests are usually reserved for cases where endoscopy is already planned due to other symptoms like bleeding or weight loss. It's important to have testing done before starting antibiotics or medications that reduce stomach acid, as these can affect the results. After treatment, repeat testing with the breath or stool test helps confirm that the bacteria have been successfully eliminated. In summary, the main methods to detect H. pylori in relation to ulcers include the urea breath test, stool antigen test, blood antibody test, and biopsy-based tests like histology and rapid urease testing. The choice depends on your specific situation, symptoms, and what your healthcare provider recommends. Always consult with a healthcare professional for personalized advice and proper testing.